This segment is sponsored by Capital Institute of Hearing and Balance.
Good Morning Washington is here in Silver Spring, Maryland at the Capital Institute of Hearing and Balance, and I'm here with Doctor of Audiology, Dr. Jacqueline Lovett. Thank you for having us here.
Thank you for coming.
Well, yeah, this is a big conversation to have because about 40% of U.S. adults actually experience vertigo at some point, which is a lot of people. So let's start off with talking about what is vertigo.
Well, vertigo specifically refers to a type of dizziness where you feel like you're spinning or a sensation of motion. But generally, sometimes people will use vertigo to cover an umbrella term of dizziness. And there's a lot of different types of dizziness, like lightheadedness, presyncope, which is feeling like you're going to pass out, and then more this motion sensation like the vertigo, and imbalance as well. 80% of the time, vertigo is a result of something going on with your inner ear.
Okay, so how is the ear a center of this?
Well, I know most people think of our ear as our organ of hearing, but actually a larger portion of our inner ear is used for balance. There's 5 sensory organs on each side, and they have gravity sensors and sensors for motion, like, bending over to tie your shoe, turning your head. And if something goes awry in those systems, then you can have imbalance, you can have vertigo, you can have nausea and vomiting as well.
That is scary. If we are experiencing some of these symptoms, what do you do if you think you're having vertigo?
If you're having vertigo, specifically this spinning type of sensation, generally people end up going right to their primary care doctor or to the emergency room, and they come back with the diagnosis of vertigo. That's like saying, you have nausea. It's just a symptom. It's not really telling you what the problem is. And so the good thing is that at the ER, they can tell you, well, it's not a stroke, it's not this. They rule out the scary stuff. But your inner ear really needs to be evaluated because that is most likely the cause when you have this spinning type of dizziness. And if there's something that we can find that is the issue, then we know how to treat it. So that might be through exercises, that might be through therapy, sometimes medication, sometimes surgery. It really depends on what the underlying issue is.
I know doctors don't want to hear this, but when something's wrong with me, the first thing I do is either call my mom or get on the internet. Is some of those online exercises really help, or where should we really get our information from?
So there are some exercises. People probably have seen things like the Epley maneuver and things like that. That is to treat a very specific type of vertigo called benign paroxysmal positional vertigo. It's a mouthful, so we just call it BPPV. But it's basically where you have these crystals that move from one part of the ear where they belong to another part of the ear where they don't belong. And it results in these brief episodes of spinning vertigo. So there are exercises that you can find online. And I feel like this is becoming more and more common because sometimes I get patients coming to me where they have vertigo that's affecting multiple parts of their ear because they've done the treatment incorrectly at home on themselves. So sometimes, yes, it may even resolve on its own. Like you might just turn throughout the day. This is the most common type of vertigo in kids as well, but they flip around so much, boop, it's gone. So it is possible that it can resolve on their own. It's possible that some of the treatments that you find online can be helpful. But if you're doing it and you're still having dizziness, then you definitely need to see an audiologist or somebody who specializes in vertigo to perform those treatments on you. It's easy. It's just a maneuver that takes a few minutes to do, and then, boop, you'll feel much better. It's about an 85% success rate with one treatment, 95% with 2 treatments. And that's the most common type of vertigo that we see.
Yeah, so we don't have to stay in it. We can get help and do those exercises and learn from you. Where do we go to get more information?
Well, certainly you can go to our website, and you can always call us to schedule an appointment. We specialize in it, so we have multiple providers that treat vertigo here and assess it. So even if we don't have the answer, like it's not the inner ear, we're well versed in other things that can cause dizziness as well and vertigo as well, so we know where to guide you for your next step if we don't have the answers.
Thank you for this information and for keeping us balanced. Get the information right on your screen.
Thank you.